Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Radioisotope scanning. In the radioisotope scanning, this radioisotope scanning will help us to find the information about the function of the individual renal units. Our function of the kidney can be found out by the uh, isotope renal scan. It detects the function of the kidney. So there are three different types of isotope renal scan. One, we have diethyl triamine pentaacetic acid, DTPA. Same, diethyl triamine pentaacetic acid. The other scans are dimercaptosuccinic acid scan and also sodium orthoiodohypurate scan can be used. So first, in the radioisotope scanning, the first scan is diethyl triamine pentaacetic acid. It is almost similar to inulin. If you remember in the physiology, this inulin will be easily filtered by the glomeruli. It is not absorbed and not secreted. It is directly filtered into the glomeruli. So inulin, so this diethyl triamine pentaacetic acid, because it is similar to the inulin, this diethyl triamine pentaacetic acid is also easily filtered by the glomeruli. From the glomerular blood vessels, it is easily filtered to the tubules. There is no absorption and there is no secretion also. There is no absorption and no secretion. So we use a gamma camera, and using a gamma camera we label the diethyl triamine pentaacetic acid with technetium nitrate and it is given to the individual. And using the gamma camera will detect the activity of technetium 99M. So we will follow up the dye which is going to the through the glomeruli and into the through the kidney and then into the glomeruli and then into the collecting duct. So like that the dynamic representation of the kidney function can be known. So what is dynamic representation of kidney function? So first, if you have given the dye through intravenous route, the dye will go to the through the veins, it goes to the through the veins, it goes to the blood supply circulation, and then in the circulation it reaches the renal artery. Okay, in the renal artery, through the renal artery it goes to the kidneys, and in the kidneys it is actually enters the glomeruli. Okay, this is the glomeruli. In the glomeruli we have the renal arteries and renal blood vessels, afferent and efferent renal arterioles with capillaries. Now here when the dye is goes through the renal capillaries, it is directly filtered into the glomerulus. Now from the glomerulus it goes into the proximal convoluted tubule, then descending limb of loop of Henle, then ascending limb of loop of Henle, then distal convoluted tubule, and finally to the collecting duct. So with the help of this gamma camera we can see the movement of this whole dye in the kidney easily. So as a result, we can find the dynamic representation of the renal function so that we will know where the problem is. So it is also useful. So this technetium DTPS scan is also useful to find the or to detect the collecting system dilatation. It detects the collecting system dilatation, because if it is going through these tubules, obviously if the tubules are dilated we can visualize them under the gamma camera. So we can visualize the dilated collected duct in the gamma camera. If there is an obstruction, the radioactivity will remain in the kidney itself, because if there is an obstruction in the um, collecting duct, like in the ureter, if there is an obstruction here, see after collecting ducts the dye has to pass from the kidney into the renal pelvis, and from the renal pelvis it goes into the ureter and then to the bladder, then to the urethra. But if there is obstruction, then you will see that the radioactivity will be left here, it can't pass downwards, right? So in order to confirm that, what we do is, if there is any obstruction, if you see that there is some obstruction and the radioactivity is remaining here, then you will give the diuretics like furosemide is given. Then if you give diuretics like furosemide will cause excretion, right? It causes diuresis. So if if even after giving the diuretics, normally if you give diuretic like furosemide, the all the urine which is formed and all the blood is filtered, from the blood lots of water, sodium, potassium, 2 chloride are lost in the urine. But now, because even after giving the diuretics, if the radioactivity still remains in the kidney instead of going out, in such cases you should suspect obstruction. Then there are other substances which can be used like dimercaptosuccinic acid or dimercaptoacetylglycine or sodium iodohypurate. All these are can be labeled with suitable isotopes, and they are also useful to investigate or to identify the renal function. We can use these isotopes like dimercaptosuccinic acid, mercaptoacetylglycine, and sodium orthohypurate.
Thank you and thank you for watching.